Have you noticed your morning erections getting weaker or disappearing completely after 60? You walk anatomy and physiology. I'll explain where each point is, how to press it safely, and how to combine it with breathing and daily habits so you see real benefits over time. If you're up, you don't feel that same morning firmness you used to, and a small voice in your head starts worrying. Is something wrong with me? Is this just aging? Is my desire fading? Or is my health in danger? I'm Dr. Rosalia Viterbo, urologist, and I want you to know something very important. A weaker or absent morning erection is not just about sex. It's also a powerful early signal of what's happening in your blood vessels, hormones, and nervous system, the good news. In many cases, your body is not broken, it's just blocked. Blood flow, nerve signaling, and muscle tension get disrupted over time because of stress, because of poor sleep, because of posture, because of small habits repeated for years. In this video, I'm going to show you 3 simple pressure points. They support better blood flow, they help your nervous system relax, and they may help restore stronger, more consistent morning erections, even after 60. No pills, no invasive treatments, just your hands and a few minutes a day. This is not magic. It's a ready to quietly reclaim your confidence in the morning. Stay with me. Let's talk about why this even matters. Most men think morning erections are just about desire, but they're actually a quiet daily health check, like a natural system test your body runs while you sleep. During the night, you should have several erections. You don't notice them. But your blood vessels, nerves, and penile tissue, do they need that oxygen-rich blood to stay healthy and responsive? So when those morning erections become weak or stop showing up, your body might be saying, something is off. Maybe your circulation is slower, maybe your pelvic muscles are too tense. Maybe your nervous system is constantly stressed and in fight or flight mode. Have you noticed you're sleeping less deeply or waking up more tired? Have you felt more anxious about your performance? And then the anxiety itself makes things worse? This is a very common cycle. Less morning firmness, more worry, more stress hormones, even less blood flow. And many men don't talk about it. They feel shame. They think, I'm just getting old. That's it. But aging does not mean you must lose all spontaneity, pleasure, or intimacy. Your blood vessels do age. Your hormones do shift. But your body also has an incredible ability to adapt. What often happens after 60 is a combination of small factors. A bit more belly fat, a little stiffness in the lower back and hips, hours of sitting every day, years of quiet tension in the pelvis. All of this can squeeze the pathways that carry blood to the penis. It's like bending a hose. Water can still pass, but the pressure drops. That's where pressure points come in. They're not a miracle cure, but they can help unbend the hose. They can relax key muscles. They can calm your nervous system. They can support healthier blood flow where you need it. And when we combine them with simple daily habits, we're not just chasing erections, we're supporting your overall health, energy, and confidence as a man. Now let's go step by step. I'll show you 3 key areas you can work on safely at home. These are not magic on-off buttons. They're pressure points that influence blood flow, muscle tension, and your nervous system. Use them gently, use them regularly, and always remember, this supports your body. It does not replace a proper medical checkup. First, the pelvic root point, perineum area. This is the base area between the scrotum and the anus. We call it the perineum. It's like a crossroads. Your pelvic floor muscles, nerves, and blood vessels all pass through here. When these muscles are too tight or constantly clenched, blood flow can be restricted. Many men hold tension here without realizing it. From stress, from sitting for long hours, from years of squeezing their abdomen instead of breathing deeply. Here's how to work this point. Sit or lie down in a comfortable, private position. Make sure your bladder is empty. Using clean fingers or a soft knuckle, gently press upward on the area between your scrotum and anus. Start with very light pressure, hold for 10 to 15 seconds while you breathe slowly in through your nose and out through your mouth. Release. Rest for a few seconds. Then repeat 5 to 10 times. You might feel a sense of warmth or gentle pressure radiating into the base of the penis. This is normal. If you feel pain, numbness, or strong discomfort, stop. The goal is not to push harder. The goal is to signal the muscles to relax and invite more circulation into the area. Over time, this can reduce chronic pelvic tension, which often interferes with morning erections. Second, the lower abdomen, flow point. Now we move a little higher. Place your fingers about 2 to 3 finger widths below your navel. This region sits over major blood vessels and deep pelvic structures. When the lower abdomen is stiff, bloated, or always tight, it can indirectly affect blood flow to the pelvis. Many men hold their stress here. They clench their stomach, especially when they feel anxious or insecure. Here's a simple routine. Lie on your back with your knees bent and feet flat. Place your palm over the area below the navel. Use the fingertips of your other hand to make small, gentle circles. Press to a level that feels good pressure, not painful. Move in slow circles for 30 to 60 seconds. Then switch direction and repeat. While you do this, focus on your breathing. Inhale slowly, letting your belly rise under your hand. Exhale fully, letting the belly soften. You're doing 2 things at once. You're physically loosening the tissues, and you're telling your nervous system, it's safe to relax. A calmer nervous system means less adrenaline and cortisol, and that means your body can shift more easily into rest and repair mode, which supports healthy nocturnal erections. Third, the lower back and sacrum release point. The sacrum is the triangular bone at the base of your spine, just above your tailbone. Important nerves that influence the penis and pelvic organs pass through this region. When the lower back is stiff, when you sit for long hours, those nerves and surrounding muscles can get irritated or compressed. Releasing tension here can improve comfort and support better signaling to the pelvic area. Try this simple pressure and stretch routine. Lie on your back on a firm but comfortable surface. Place a small soft ball, folded towel, or cushion under the back of your pelvis, not your lower spine. Think of the area just above your buttocks. Gently shift your weight from side to side, allowing the ball or towel to massage the sacrum and nearby muscles. Do this for 1 to 2 minutes while breathing slowly. Then add a stretch. Pull one knee toward your chest, hold for 15 to 20 seconds, then switch sides. Finally, pull both knees gently toward your chest and hold. You should feel a mild release in the lower back and hips. This can improve overall pelvic comfort and posture. Better posture can reduce pressure on the blood vessels that lead to the penis. How often should you do these? Think of these pressure points like brushing your teeth. A little bit, consistently, works better than a lot. Once in a while, aim for 5 to 10 minutes a day, or at least 3 to 4 times a week. You can do them before bed, or after a warm shower when your muscles are already relaxed. Important supportive habits. Pressure points work best when your overall lifestyle supports blood flow. So, along with these techniques, focus on 3 key habits. 1 gentle movement every day. Even a 20 to 30-minute walk helps your circulation. It lowers blood pressure, it supports a healthier weight, and it encourages better nighttime blood flow to the penis. Second, better sleep routine. Most nocturnal erections happen in the deeper phases of sleep. If you go to bed very late, use screens in bed, or wake up many times, your body has less time for those natural erections. Try to go to bed at a similar time each night. Darken your room. Avoid heavy meals and alcohol right before sleep. 3. Check your risk factors conditions like diabetes, high blood pressure, high cholesterol, and smoking all damage blood vessels. They don't just affect your heart, they affect erections too. If your morning erections have changed significantly, or if they suddenly disappear, please talk to your doctor. A simple checkup, plus some blood tests, can reveal important information about your health. Don't worry if you don't see changes overnight. This is your body, not a light switch. What you're doing with these pressure points is giving your body better conditions, less tension, more circulation, a calmer nervous system. Over weeks and months, this can support stronger, more reliable morning erections. And just as important, it can support your sense of confidence, energy, and connection with your partner. Let's bring everything together. Morning erections are not just about desire or masculinity. They are a quiet health signal, a simple, daily sign that blood flow, nerves, and hormones are working in harmony while you sleep. So when they become weaker or disappear after 60, it's understandable to feel worried, maybe even embarrassed, but it's also an invitation your body is asking you to pay attention. In this video, we focused on 3 key pressure areas, not as a miracle cure, but as practical tools you can use with your own hands at your own pace. First, we talked about the pelvic root point in the perineum, that small area between the scrotum and anus. Gently pressing there helps your pelvic floor relax. Less clenching, more blood flow, more comfort in the base of the penis. Second, we use the lower abdomen flow point just below the navel by making soft circles and breathing deeply. You release tension in the belly. You tell your nervous system, you can calm down now. Less stress means better nighttime erections. Third, we focused on the lower back and sacrum release by using a soft ball or towel and gentle stretches. You ease pressure on the nerves and muscles that support the pelvic area. Better posture, less stiffness, improved support for blood vessels traveling to the penis. Then we added simple, powerful habits. Daily movement, better sleep, checking and managing risk factors like blood pressure, sugar, and cholesterol. All of these pieces work together. You're not just chasing a stronger erection, you're supporting your heart, your brain, your energy, and your long-term vitality. Remember, it's normal for the body to change with age, but normal change does not mean you're powerless. You still have influence. Always listen to your body. Notice the signals it gives you. If something changes suddenly or significantly, especially your erections, see your doctor. Think of it as a proactive step, not a failure. And as you practice these pressure points, be patient with yourself. Consistency matters more than intensity. Gentle, regular care beats aggressive, uncomfortable force. Your sexual health is part of your overall health, and you deserve to feel confident, respected, and informed about both. If you've watched until this point, it already tells me something important. You care about your health. You care about your confidence. You care about staying connected to the person you love. In every way, I want to remind you of one thing. You are not alone in this. So many men after 60 experience these changes. Most stay silent. You chose to learn that already puts you ahead. If you found these explanations and techniques helpful, and you want more calm, science-based guidance about men's health, hormones, erections, and aging, I'd be honored to be your doctor on this journey. You can subscribe to this channel for more videos like this. Simple routines, clear explanations, tools you can actually use at home without shame and without fear. And if you think another man in your life could benefit from this information, you can quietly share this video with him. Sometimes, one conversation starts real healing. Thank you for spending this time with me. Take care of your heart, take care of your sleep, take care of your sexual health. They are all connected. I'm Dr. Rosalia Viterbo. Take care of your health, and I'll see you next time.